I'm Tom Shannon, and I'm an Associate Professor and Urological Surgeon at the Prostate Clinic. Today we're going to talk about NanoKnife IRE for prostate cancer. NanoKnife IRE is a focal therapy that uses electricity to kill the cancer. In the age of PSA testing with good MRI visualization, we're able to detect cancers when they are smaller, but also to identify exactly where they are in the prostate. This opens up the possibility of just treating the cancer. MRI has a special trick of being able to see the cancer by using movement of water under a high and level magnetic field. We can tell the difference between normal glandular architecture, where there is a ring of cells with trapped water and free water in the lumen, versus an area where we have tightly packed cells, such as in a cancer. This will show as a dark region, which on biopsy can be proven to be a cancer. Not all of these lesions will be cancers, but the ones shown to be are very reliably just seen in the spot detected on MRI. Focal therapy means just treating the cancer. Good focal therapy will kill the cancer and give us the exact same effect as we desire from whole gland therapy, but without the risks of damage to surrounding structures. There are various different types of focal therapies that can be used. If we can see a cancer, then it can be targeted. In this animation, we can see radiation's effect. Radiation can be very effective in this situation, but radiation energy will damage surrounding tissue, not just cellular tissue, but supporting structures as well. This can lead to an inflammatory damage and scarring, which can be problematic in the urinary tract. Focal therapy with heat or with cooling has an issue with heat sinking, where we can undertreat near blood vessels with the moving blood flow taking heat or cold away. NanoKnife IRE uses precise electrodes and a computerized system to deliver just the right amount of electricity through the cells to damage the cell walls. Needles can be placed around a tumour, and electricity passing through opens up pores in the cell wall, which lead to cell death. The damaged cells then die and are reabsorbed by the body. The interesting thing about NanoKnife is it doesn't tend to damage supporting structures. Things like blood vessels and nerves and supporting collagen remain intact. And with the healing process, these can return to normal. It has a very reliable area of effect, and it's very easy to see on repeat MRI where the treatment has happened. This makes it ideal for use in an area like the prostate. In this video, we can see an animation of the treatment. NanoKnife IRE is ideal for prostate cancer. The prostate is an area where it needs to function for urinary function. Both continence and sexual preservation are important. Cancer can be accessed for treatment in much the same way as it is during a biopsy, through the skin under the scrotum. This allows us to effectively treat just the cancer without damaging continence or erections. The precise electrodes are controlled with the NanoKnife system. This is an outpatient procedure that takes roughly an hour with minimal recovery time and return to normal within a few days. You will be asleep under a general anesthesia, and you'll have a catheter placed in your bladder. An ultrasound is done to precisely locate the tumour and confirm the positioning of the needles so that personalised planning can be done. The electricity is delivered to the exact right level to destroy the cancer without destroying surrounding structures. In this video, we can see an area of tumour at the left apex. This has an increased blood supply, which we can see on the dynamic contrast enhanced phase of the multiparametric MRI. In that same area after treatment, we can see how there is no longer blood flow shown by the large dark area. It's also important to note the lack of damage around the area of the prostate. So the NanoKnife has effectively killed the cancer without damaging surrounding structures. In this case, the patient had no pain and no incontinence. After treatment, an MRI is needed and further biopsies are done at around 6 months. PSA usually falls dramatically, and PSA testing can be very reliable to track and monitor. Over a period of around 10 years, about 20% of people will need another treatment. Most of these treatments are done because of a new tumour somewhere else in the prostate. Not everybody is suitable for this therapy, so to find out if you are, please contact our office to arrange a personalised review. NanoKnife is an exciting new development in the treatment of prostate cancer in Australia.